know how many types of depression there are? It's a question that many might struggle to answer. Depression, a common but serious mood disorder, affects millions of people around the world. It does not discriminate, touching lives indiscriminately across age, race, and gender. Understanding depression is not as simple as it seems. It's not just feeling sad or going through a rough patch. It's a complex mental health disorder that comes in many forms, each with its own set of symptoms, causes, and treatments. From major depressive disorder to seasonal affective disorder, from postpartum depression to atypical depression, each type presents its own unique challenges and requires a tailored approach to treatment. Why is it important to know the differences? Because it helps in providing the right treatment and support to those who need it. It's about empathy, understanding, and the power of knowledge. Stay tuned as we delve into the various types of depression. First on our list is major depressive disorder. This is a mental health disorder characterized by a persistent feeling of sadness or a lack of interest in outside stimuli. It's not just a case of the blues, it's a chronic condition that can significantly impede your ability to function in your daily life. Symptoms may include a persistent feeling of sadness, hopelessness, or emptiness, loss of interest in activities you once enjoyed, changes in appetite or weight, and difficulty sleeping or oversleeping, among others. It's crucial to remember that everyone's experience with major depressive disorder can be different. Seeking professional help is essential. Treatment options often include a combination of medication, psychotherapy, and lifestyle changes. Antidepressants can help manage symptoms, and cognitive behavioral therapy can provide coping strategies. Regular exercise and a healthy diet can also play a significant role in managing this disorder. Major depressive disorder can be debilitating, but with the right treatment, there is hope. Now, let's talk about persistent long-term depression disorder. This type of depression is not a temporary state, but a chronic condition that can last for years. Imagine feeling persistently sad, losing interest in activities you once enjoyed, experiencing changes in appetite or weight, and having difficulty sleeping. These are some of the symptoms that individuals with persistent long-term depression disorder may face. This isn't a fleeting feeling of sadness, but a long-term battle that requires constant management. But don't lose hope. Just as there are treatments for major depressive disorder and situational depression, there are also effective treatments for persistent long-term depression disorder. These may include medication to help manage the symptoms, psychotherapy to provide emotional support and coping strategies, as well as lifestyle changes. Regular exercise, a healthy diet, and good sleep hygiene can be significant contributors to managing this disorder. Remember, persistent long-term depression disorder is a long journey, but with the right treatment, it can be managed. It's crucial to seek professional help if you or a loved one is experiencing these symptoms. Remember, there's no shame in seeking help. It's the first step towards recovery. Situational depression. This is a different type of depression, not long-term but short-lived, often triggered by a traumatic event or a series of stressful occurrences. Unlike the persistent depressive disorder, its symptoms are short-term and closely tied to specific stressors. The signs of situational depression include profound sadness and a sense of hopelessness, a reduced interest in routine activities, and issues with sleep. The encouraging news is the availability of effective treatment methods for this kind of depression. Interventions typically involve psychotherapy, techniques for managing stress, and in some cases, medication. Remember, seeking help when life becomes overwhelming is not a sign of weakness, but a step towards recovery. Moving on to a different type of depression, bipolar disorder. This is not your typical depressive disorder. It's characterized by periods of depression that cycle with periods of extreme elation or mania. Picture it like a swing. One moment you're down in the dumps, the next you're on top of the world. Bipolar disorder doesn't follow a set pattern. Some people may experience more depressive episodes, while others have more manic ones. The severity and duration of these periods can also vary greatly. Now you might be wondering, how is it treated? The most common approach is a combination of medication and psychotherapy. Medications can help balance mood swings, while therapy can provide tools for managing stress and dealing with disruptive thoughts. But remember, it's important to work closely with a healthcare provider to find the right treatment plan. Bipolar disorder is a roller coaster, but stability can be achieved with the right treatment.